talk a little bit about urine reagent strips. And the reason we're having this conversation is mainly because I suggested it. When I was in an active flare, my doctors would see me with frequency. So my nephrologist would see me with frequency and they would test my urine in the office. But when I was doing better and I was on the medication and things were under control and I was in treatment, but I wasn't going, maybe I was going once every 3 months at that point. My doctor wanted me to test my urine a couple of times a week, just to maybe to have a little bit advanced notice if something was changing, so that I would know to come back sooner. So I wouldn't say that this replaces what my doctor does, but it was his idea, and he was a nephrologist, and he wanted me to have a guideline at home to alert him if something was changing. It was just one of many different things I was doing, but let's do the unboxing, as they say. This is, I bought them, I think I bought them online at the time. I tried to find them in my local drugstores and could not. But I did ask my pharmacist, and he said, if you can't get them for any reason, come back or just call me and I'll order them for you. So I thought that was good to know. But it basically comes in a very well sealed bottle like this, and there are 100 strips inside it. I did notice that there's a blank spot on here where you're supposed to write the date that you opened it, because there's probably some guidelines about how long this is good for. I'm not familiar with that, and that is probably something we should look into. I don't have to use these because I'm in remission, but I would buy a new bottle if I was going to use these after this. But just to give everybody an idea what the process was, you would open the bottle up, and when you look inside, there's all sorts of these test strips, and I'm just going to pull one out, and the directions say pull one out and then reseal the bottle fairly quickly because they want it to stay tight and sealed. So this is what the strip looks like. Sorry, this is what the strip actually looks like. It has a bunch of different colors on it, and you'll be able to see on the bottle that there are some matching strips of color that you would put this up next to give you an idea of how you were doing. And you can't see it, but these little tiny numbers right here, or words right here, are the references that you need. Now, my doctor wanted me to do this to check for blood and protein in my urine. There are many other things on here that I don't check for. And I actually asked him about them because I thought it was off in color from what the label said. And he said, you don't worry about those things. And it's because that was not necessary. It also, on this, there's an instruction chart on here. I don't know if you probably can't see much of it, but basically it tells you how long you would wait before the reaction occurred. But let's go back to the basics, because this was the part that was hard for me. I got these strips and I was supposed to test my urine, and I really just floundered for a while because I didn't get any instruction on how to do that. So this is what I came up with, and it wound up working very well. A Dixie cup, about the same size. And I would, utilize this to gather my urine. And then I would turn it sideways over the sink, dip it in this way, turn it over, pull it, and then pull it out. And I just held it, disposed of this. And for me, it was 60 seconds for both the blood and the urine. So I just held it for 60 seconds, and then I compared it to the chart that was on here. And that's basically what I did. Does that sound, I don't know how familiar you are with these, or if you've ever had anybody been advised to use these at home, but that's basically what I had to do to test the urine.
Yeah, I think those are good points, Kathy. One of the things you mentioned, that you did hold the strip horizontally,
right?
And don't hold it upright or down, because the urine would keep on dripping down after you hold. And so as it's drying, as you're waiting for that to dry, and to react, you wouldn't want to be holding it so that more urine would be going down onto the other parts of it. So that's
because you can see that there's all these different separate things that it's testing for. So you wouldn't want to continue to change the level of urine
to
that's on them.
right. That's right.
So
Yes.
that's what I found as well, because every once in a while I would have a reading that was like crazy, and I was like, oh, I must not have done that right. There's a lot of instructions here. This is a pretty big pamphlet of all sorts of things that you can read. And I am the kind of person that will ask my doctor questions when I read it, but I asked questions at the office after I used them the first time, and I got a little bit more help from that. Actually, they have cups at your doctor's office when you go in, the little jars that are sealed, and you know the procedures for properly collecting urine if you have to do it, because they give you the procedures. So it's not a big stretch to be able to do it at home. It wasn't for me.
Right. And another thing, I'm glad that you mentioned that you looked at some of the other things that the strip measures, and the doctor said, just don't even look. Just concentrate on the red blood cells and the protein for you, because one of the things that strip will show is blood sugar, the amount of sugar in the urine. And years ago, that used to be the only way, or the most common way to check for diabetics, to see how their glucose was doing, was to dip their strip in the urine. But actually, having glucose spill over into your urine is a pretty late sign. It has to be pretty high for the urine to actually show up glucose. So you wouldn't ever want to say, oh, my glucose is fine here on this strip, because that's not a very accurate way to check it. So just like you said, look at the ones that the doctor told you to look, and don't go messing around with other ones.
That's right. He specifically told me when I asked him about those, you're looking for protein and blood in the urine. There's only 2 things on here that you're looking for. Don't worry about the other things. We have tests for everything. Right. They run my labs every time I would go in there. Again, this was just, he gave me the parameters. I knew what I was looking for. And I didn't go evaluating everything else on the bottle.
Right.
It was enough for my lack of medical brain just to do what he asked me to do. So
right. Exactly. Well, you did the right thing.